South Africa's NHI embraces digitalization amid funding and legal hurdles. The South African government is poised to overhaul the nation's healthcare system, striving towards a more inclusive model under the National Health Insurance (NHI) scheme. This ambitious initiative was emphasized by Finance Minister Enoch Godongwana during the medium-term budget policy statement delivered on October 30th. A pivotal step in this direction is the digitization of health records management, a move indicating the administration's resolve to modernize and streamline service delivery across diverse sectors. Digitizing processes marks just one aspect of the government's broader framework to construct a capable, ethical, and developmental government, with digital infrastructure playing a significant role in service provision. The spectrum of development touches on simplifying social grants applications, expanding employment pathways, rolling out digital identification documents, and creating a centralized government service portal. In preparation for the NHI, all health records will be digitized, a foundational measure for the new system. This insurance fund under the government will allow all eligible South African residents access to both public and private healthcare providers without direct payment. The NHI legislation, however, has been met with considerable opposition, challenging its viability and funding mechanisms. One of the critical points of contention is the model's affordability. Local stakeholders are skeptical, noting South Africa's absence of a clear funding model for the NHI, with analyses suggesting nearly a twofold increase in the current healthcare budget. The country's long-standing fiscal deficits and tax pressures exacerbate these concerns. Private sector estimates raise the projected cost to R$900 billion per year, accounting for 63 million beneficiaries. Nicholas Crisp, NHI Deputy Director General, previously communicated that redirecting medical aid funds to the NHI implies higher taxes. This perspective is troubling for South Africa's finite tax base, potentially demanding tens of thousands of additional rands per taxpayer annually. The NHI is foreseen to be financed through a combination of tax adjustments, shifting departmental funds, and integrating provincial budgets, escalating the taxation debate and the risk of significant economic repercussions. Besides funding reservations, the NHI also confronts potential legal disputes that might obstruct its implementation, with several stakeholders having threatened or initiated legal actions. These could prolong the litigation process for years, impeding the progress of the NHI rollout. As South Africa moves towards this unified healthcare framework, a detailed analysis of both its scope and substance remains crucial. Whether the government can successfully digitize healthcare records while mitigating funding and legal challenges is a question that will substantially shape the nation's fiscal and social landscape in the forthcoming years. Thank you for choosing Satori News.